Hey, welcome to Life Transformation Church. I'm Pastor David, and we're glad you guys are tuning in with us today. We want to do this session called March Madness, a discussion on mental health. We know March Madness is usually, about the basketball thing, but we don't want your mental health to drive you mad. And so we thought it was important as believers to keep this conversation in front of you because we know that it is key, it is very important. I don't care what age you find yourself in, mental health is important. People are struggling in the pandemic, coming out hopefully to the endemic, and so we know that it is key. And so we have some gifted and anointed people up here, some believers who are going to share with us their experience as we deal with this March Madness, a discussion on mental health, fear, anxiety, and depression. So we have committed to this at Life Transformation Church to do at least once a quarter. And so we are grateful again for you tuning in, and call your friends, tell them to watch it, as we are streaming on Facebook Live, and we're going to, just share this, and it'll be also on our YouTube channel and on our website, so you can come back and watch it and get some information and some resources. We will have our panelists' information on our website, because they have their own private practices, some of them, and so you want to reach out to them and schedule a session or whatever you may need. They are available to do that. First, I want to introduce our panelists, and I'm going to start to my left here. We have Dr. Anthony Rivers, and that's who he is, Dr. Anthony Rivers. We also have sitting here to my left the lovely Wanda Jones. Wanda Jones, who works in the Columbus City School System. Her title, I think, is Social Emotional Specialist. That's it. I was kind of struggling with that, but yeah. But she's been in the school system, various school systems, and really has a heart for the children, and actually has created some curriculum around suicide. Am I correct? She's out there on the forefront, out there putting the work in, trying to help our kids, and so she's going to come really with a wealth of knowledge from that perspective, and we'll get into that later. And then to my immediate right, we have the dynamic duo, the doctor and Dr. Greg and Dr. Dorena Alfred, and they are there. They're a tag team, a couple like none other, and so we thank God for them and their gifts. And they're very humble people. You see, they just, cool, cool like that. And so we just thank God for cool Christians. And so we're going to hop right into this discussion. And our first question is for Dr. Greg. And it says, how does depression impact men? How does depression impact men?
So depression, if you've met one depressed person, you've met one depressed person. It doesn't affect men, every man in the same way, but there are some key factors. To start off with, I think a lot of times depression in men doesn't necessarily always look like sadness, but it would look like low motivation, difficulty paying attention to things or difficulty attending to things. A loss of interest in things that people like to do. Like, for instance, I'm a college football fan. College football season comes and I'm telling you I'm not watching my favorite team, play football. That would be a loss of interest. It could look like irritability a lot of times. So being like snappy for no reason, snapping at people, snapping at, being triggered by very minute things like spilling milk or spilling, dropping an egg or something like that. It could look like substance use, because oftentimes instead of kind of expressing how we feel, a lot of times people will use like substances, drugs, alcohol, food, to kind of cover their aspects of depression or their symptoms of depression to make them feel better or to distract themselves from that. So those are just some very basic things. It could also look like having suicidal ideation, and I'd want to point that out. Sometimes people get overwhelmed with things and they decide that they don't want to be here. Those feelings can be, very subtle, or those thoughts can be very subtle, or they can be very prominent. So I would say that if you see somebody that's starting to think about like not wanting to be here, or they start to use language like they want to give, they give their things away, or they start to have these other symptoms, but then you see them like kind of like disconnecting from other people, because disconnection is another symptom. You might want to check in with that man to ask if they're okay. And then one thing that I would say is that asking somebody if they're having those kinds of thoughts doesn't actually put the thoughts in their brain. Sometimes we want to avoid asking those questions because we don't want to impede or intrude. But sometimes extending a hand or asking about something, asking how somebody's doing, that's kind of an ability to check in with somebody, especially a man, because we're kind of not socialized to talk about our feelings a lot. So those are some signs.
Thank you. Next question is for Dr. Dorena. How does depression impact women? Is there a unique difference, or it kind of flows together? Do women do more, have different tendencies than men do?
Yeah, I would say it's pretty similar. Women may also notice like the irritability or agitation, easily frustrated, but there also is more likely to be some of that low mood, sadness, crying, not being able to explain why you're feeling tearful, but still having that experience. So I would say that's maybe one of the subtle differences between the way it may manifest for men than the way it manifests for women. And that's, I think, one of the primary focuses, I would say, one of those differences. I think it can also make you, women will also report feeling overwhelmed, easily overwhelmed, having too much to do, too much on their plate. And so that, I think, can be another sign of depression. Also, it can kind of overlap with anxiety, but I think that's one of the ways for women that it comes out, is that feeling of overwhelmed. Yeah.
Okay, so is that feeling of overwhelm, is that a false sense of being overwhelmed that they're really not in actuality, but it's just how they feel?
Well, it's like if it feels that way, that's your reality still. So
okay.
It's like other people may say like, well, why are you feeling overwhelmed, or you're not doing anything different. But it's really, if that's that person's experience, that is, part of how it might manifest for them. And so then you may have similarly that withdrawal of, I don't want to do things. I think the low energy is also something that women will experience, of just being tired and not wanting to do the things that need to get done. And so it, I think, can manifest both ways. I think one of the other just quick things, some people will say, I don't feel depressed because I go to work every day. And it's like, okay, that's nice, but what happens when you get home, and being able to kind of see that, how am I functioning after I've done what I needed to do through the day? Because if you feel like I got to function at work, then you're going to do what you need to do, but it doesn't mean that you're going to still function the same way. You may have felt like I've given all that I have to give, and so that functioning after work may look very different.
Okay. I guess for people looking at me, it's like, why are you asking that kind of question, because from maybe a spouse standpoint, if I'm, married and I think, I don't see my wife's plate any larger, and I was like, so what are you talking about? You overwhelmed, I'm checking the boxes. And so for me, I may say that, well, that's not, I don't think you're overwhelmed. You've been doing the same stuff for the last 9 years, So thank you for the explanation, because that person's reality is their reality, And it could not be a spouse situation. It could be your brother, could be your sister, could be your friend. People say that we need to take that stuff to heart and not just dismiss it as in, I don't see anything different in what you're doing. So thank you. Next question is for Wanda. How does depression impact students?
A lot of the same symptoms as have already been described by our panelists, but what it might look like in a school setting is that, number one, your child may not want to even come to school. It may be difficult to get them to wake up in the morning and they just want to sleep. But once they do arrive to school, a lot of times they isolate, and maybe they were involved in some activities and now they're no longer interested in those activities. Their grades may drop. And the things that we really see where we could identify it more specifically is on their social media. So they may express their emotions there. And as a parent, you definitely want to pay attention to what they're posting in any social media form. But also social media can contribute to depression and anxiety and all of those sort of things. And so we see a lot of our students who get into altercations over social media, and then that spills over into the school, and a lot of times depression can manifest itself as anger. So they may be frequently involved in altercations with other students. And so we think they're angry, but the root of it really might just be that they're depressed. And so it can manifest itself in many ways, but what I've seen is students who are very serious about wanting to harm themselves, because of course that could be a result of it. Usually you don't know. They could hide that very well, but then that can spill over into suicidal ideation. And so that's why we try to talk to our students about what that looks like. What are the signs, so that if you're a friend of somebody who is distributing those signs, that you notice that and that you go tell a trusted adult. And so, because a lot of times those who are dealing with that won't talk to anybody about it. They want to just hide it, and next thing you know, you have a problem that you're noticing and you didn't have a clue. A lot of times our parents say, wow, I had no idea, right, that my child was even suffering like that. So it can be, you got to stay engaged in your child's life. You got to know what they're into, and yes, you can give them some privacy, but while they're in your home, you should know what the heck they're doing with their social media and what they're doing with their friends and who they're hanging out with. Also, the music that they listen to can be a very telling sign. And so there's just so many different things. We want to make sure that our kids are staying active. If they're involved in activities and you see that all of a sudden they're not wanting to, that could be a huge sign. So it just can look so many different ways, and there are so many different people in the school system that can support our kids. But as a parent, you have to be very cognizant about what your children are doing with their time in school and outside of school. Spending time on their phones consistently can be very devastating to their self-confidence and their self-esteem. Just that's the nature, unfortunately, of social media, and so we see that playing a part in so many of the negative behaviors that our students demonstrate.
So I hear you saying that social media plays a huge role in students' behavior. And so a lot of stuff starts on social media, then manifests itself in the school.
Absolutely. There was just an incident at a school I was at yesterday where there was some things exchanged between some girls, and it happens primarily a lot with our female students. They like to get on there and say things to each other and threaten each other and say, oh, let's fight, let's meet up here or whatever. And then when they're in the school setting and they have an audience, right, they will yell at each other and, want to act like they want to fight, but the reality is they really may not want to do that. But because they have an audience and kids are constantly with their phones trying to videotape what's happening, they feel the pressure to engage in those sort of things. Like, they don't want to look like a punk, right? So they definitely feel the pressure to address if somebody says something to them on social media and other people can see it, they feel a need to address that in front of an audience. And that's why it happens in school. Now, we do have some cases where they handle it out in the neighborhood, but primarily they bring it into the school because that's where their friends are, and they have this mentality that all their friends are going to be there with them when they address that other student. And so it just creates a lot of disruption in the schools. And depending on the age level, you may see it look a little differently. I work primarily in the middle schools, and our girls are dealing with just their own self-esteem in a lot of ways, and so that really impacts them most significantly. And yeah, so social media please just make sure you are monitoring that to the best of your ability, or just preventing them from having it at all.
Oh boy, I know some kids right now are cringing in their seats and as they're watching online. So, what do you mean, no social media? You know, so people think their parents being nosy, you know. As my father used to tell us, you know, that we stayed in his house. and everything in that house belonged to him. And he could look where he wanted to, and whenever he got ready. And so I abide by those same laws, you know. What's good for David, it's good for Lexi. And so, yeah. And so we need to be, it's not that you know, and I think one thing, and anybody can speak to this, it's not good for parents to be their children's friend. You are called to be their parent. You are to advise them and to help them. You know, some of this stuff we could squash at home. So please don't, you know, think that you're your daughter's friend. You know, she's your best friend. She can be your best friend, but you need to get in her business about stuff, you know, so they can avoid some of these pitfalls that Wanda's talking about that plays out in school, you know. So anybody else want to speak to that?
I just have a quick follow-up. Wanda, could you say a little bit more about the music?
Absolutely. Gosh, there are actually artists currently that their music is specifically, maybe because they're dealing with their own mental health issues, so it comes out in their music.
Wow.
And they talk about suicide, they talk about depression and their own personal struggles with it. And, you know, so you'll have that, but you'll also have some music that encourages, I think, younger kids that are more heavily influenced by, because that's their thing, right? Whenever they can't cope with a situation, music is their go-to, and that's fine, but the right type of music really, you know, is what's most important. And so encouraging your children to listen to uplifting music or music that is just helpful and not hurtful. And so, again, paying attention to the musicians and the artists that they listen to, or maybe that they talk about or want to emulate, right? Because there's so much that's happening in the world around them. They have access to anything and everything that they want 24/7. And that is the challenge that we deal with regularly, is that if they want to know how to do a math problem, they can look at it on their phone. Why do they need to learn it in class? And that's the struggle, because they know they have access and they can watch anything that's out there. So there are tools, right, that as parents we can have control over what they have access to. So those are really important tools for us to use. I mean, these kids have access to their Chromebooks or whatever devices that they use in school, and the school systems have to put things in place to prevent them from accessing different sites, because if not, those kids will spend all day, you know, we think they're working, but they're actually looking at porn, and
Lord
they are sending photos of each other. You know, maybe a boy has requested for a girl to send him a picture, and then he distributes it to all of his friends. That can cause our young ladies to really suffer a lot of serious issues. And so, again, having access to all of that has been a huge impact on our kids. And if the parents aren't doing their part, there's not much the schools can do about it.
Okay. Thank you. Since we want to play well with others, we want to leave Dr. Riversard over there. I know you're looking a little lonely over there, so.
I'm good, my brother. I'm learning.
So that's the key thing. I'm not even going to touch on that. He said he was learning. Even in his current, he's been to school, has his PhD, and Dr. Doreena's shaking her head. They are all, you have to be a lifelong learner. You know, I'm learning as a parent. You know, there's no book, no playbook for me. You know, what my parents did with me is different, because I grew up in a different era than I'm raising my daughter in. You know, I didn't have no 24/7 access. You know, Yeah, so all the stuff, we have to use new tools. We always need to keep our eyes and our ears open to new methods and stuff like that so we can try to be the best we can for our kids. All right, Dr. Rivers, how does depression impact teens?
I know we've talked a lot about that. I think I'm gonna piggyback, I'm asking this question, but I'm gonna piggyback on your question about kids being, parents being their kids' friends. I think in this particular topic, it really connects because oftentimes, we have daughters and really all of our daughters will say, what's up, bestie? That kind of irritates me. Because I'm just kind of like, I'm glad we're connected, but understand that if something happens and you're struggling with something, I'm gonna respond like a parent, not your best friend. Because as a friend, sometimes you just literally want to support them, but as a parent, you have to put boundaries. You have to make the calls. If they want to hurt themselves, that's a tough call to make. If you're talking about if they need medication or anything like that, that's a tough decision to make. But you have to make it as a parent and not their friend. So I think, for the parents that align with them as being friends, and I see a lot of teens in my practice, I just think some parents make horrible choices because they align with them being more friends than being their parent. But I think specifically the teens with depression, two of the things that kind of sticks out for me. One is a symptom we call anhedonia, and what that means is an inability to experience pleasure. We see that with guys, like what Dr. Gray was talking about it, but with teens in particular, like if they like softball or whatever the case may be, or they like being around a lot of friends and things like that, and that has changed, then I think that's one of the greatest signs, because a lot of teens are not going to say, some will, but a lot won't say, hey, I feel depressed. You see behavioral changes, so you have to kind of interpret their emotions through their behavioral changes, because they're not going to express that as much, as well as isolation. That's a big key. Whenever they start isolating, especially if the person isn't typically an introvert, but if they become more isolated in that regard, you might want to kind of dig deeper with that. So I would encourage parents that, because depression doesn't make you feel really good or anything like that. I mean, they're gonna feel blah. They're gonna be irritated. They're not gonna be happy about things. So you can't let that push bike stop you. I would say if you feel that push bike, you have to keep going. It's a hard thing, but you have to keep pushing. Their job is to make you get away, and your job is to make sure that they're okay.
That's good. Yes, sir.
Sorry, I wanted to add
No need to be
something,
sorry.
something to that. I didn't want to step on it. You know what I'm saying?
Go ahead.
Step on it?
No, you good.
All right. So, to that point, I think, depression kind of influences you to build a cocoon around yourself, where, you feel less interested in doing things, and so you choose to do less things. And I think that makes it harder to break the cycle of depression, and so to your point, there's this thing that I talk to my patients about, which is behavioral activation, which you kind of touched on, but it's like, if you don't feel like doing something, then that's the time to get up and do something, because the less you feel, the more you give in to that urge to not do something, the easier it is to not do stuff, which adds to the feeling of depression. I don't do stuff, so I can't do stuff, so I won't do stuff. I think that just kind of turns into a cycle. There's a term that I use, it turns into a cycle that goes down, that can deepen your depression. And so I think getting up and making yourself do stuff when you tell yourself you don't want to, I think that can be really helpful of getting out of that cycle of depression. So I just want to
and based upon that as well, I know I'm talking about teens, but with adults, oftentimes I know that the way you keep your home and things like that isn't truly a symptom, But I know one of the things that I found with adults is that the more depressed they are, the less they want to upkeep on things. So it's like, so if your home is typically great, but now it's trashed and you know that person isn't keeping up themselves and stuff like that, that's also one of those signs that the outside is beginning to look like what they feel like on the inside. So it's one of those things where it's not a traditional symptom, like what we're saying, but I think it's one of those signs that you can look at to see how much this person may need help.
And in those situations, how much do you push that individual to maybe, to get up and do those things? Is it going out? Is it, just saying, hey, we gonna go out and go on a date or something, or we going, girl, I'm gonna get you out the house, because that she needs to get out of the house, or man, I'm gonna swing by, we gonna go watch some games at the bar, we're gonna have a couple of beers and sit back and have a good time, blah blah blah, Now, how much push do you, is it a level, a boundary of pushing, or you just kind of do it?
That's a good question. I think you do as much as they allow you to, if that makes sense.
Yeah.
Because, there'll be some people who you'll say, come on, let's go. And, they may say, I was really gone. I don't really feel like it. And, there's people, and we all have those people in our lives where we can push a little bit more and be like, come on, I'm coming. I'm going to just swing by. Okay. And then you'd be like, oh, Lord, they're going to swing by. But you still, okay, I need to get myself together. And I think to both of their points, you're not going to feel like going, but for the most part, if you get out and you go, you do feel better. Like if you're around someone and whether you talk about what's bothering you or not, but just being out, new environment, new perspective, just getting out of your space, that's a new perspective and that can help. So I think just that idea that you're not going to feel like it when someone asks you to, and you may really legitimately want to be in your bed or on your couch, but it's like, what is that doing? Back to that cycle, what is that perpetuating? And so some people will be on board and say, okay. And then some people are like, no, I'm not going to. And so, you do still sometimes have those friends where you still go to their house and you sit on the couch with them, and sometimes that's okay. We may not be able to get out of the house, but can I be there with you? And sometimes that's enough. But I think you do as much as a person will allow you to do, and maybe they, dig their heels in and say, I'm not gonna open my door, or I'm not gonna do this, and then it's really time for intervention. But you keep trying. If you don't open the door today, I'll be back again. And you just keep making the effort, because otherwise it really becomes a cycle that's hard to break. And it also feels good, even though in the moment it might not. It feels good when you're not doing something by yourself. You're not struggling by yourself. Somebody's there with you. Even if you don't know you need it, oftentimes it helps.
Okay.
Yeah, I just wanted to add, kind of from the other end of this spectrum, is that we don't want to overreact, because there's a difference between being sad and being depressed. Mm-hmm. And sadness can be the cause of, maybe a breakup. Maybe the boy broke up with your daughter and she's sad. Mm-hmm. It's the long-term symptoms that we have discussed that really indicate depression. And so you've got to gain the knowledge yourself so that you understand the differences, because if you overreact, you always want to be supportive of your child, but just knowing that you are maybe noticing something for a couple of days, that doesn't necessarily indicate depression. Depression is real, but it also is something that needs to be treated. And if it's just for a passing moment or maybe a week, okay, we can deal with that. But if it prolongs beyond that, that's when you really want to say, okay, we need to take some other steps, seek professional help, because when it gets to that point, then it's nothing that maybe you can really handle, right? As a parent, you need to seek out professional guidance on that.
All right, thank you all. All right, Dr. Arena, what are some possible ways to cope with depression?
I would just kind of, again, speak to the idea of like knowing yourself and paying attention to what you're doing. And that's really hard when you're in the midst of, depression. You may have the insight to, feel like, oh, okay, here's that thing again, because depression can be cyclical. So it can come and then you can be well, especially like if you're on medication even and you're doing well and everything's fine, and then it comes back again. And for some people, it's hard to understand when it comes back again, because it's like, well, I'm on my medication and I'm doing the stuff I normally do, but it's cyclical. And so that can be a frustrating part of it, because it just can shift, and sometimes it doesn't have to even be something particular like a specific event. It just happens again, that it cycles around. Oftentimes it can be triggered by something, but it doesn't have to be. And so that can be difficult. But if you have that insight of like, okay, I notice I am doing this, or even someone around you says, okay, I notice you're not wanting to get out, this has been going on for a few weeks, and someone explains that to you. If you're in a position, and it's really tough, because when you're depressed, when you're really in a depressive episode, again, you're not gonna want to do the things that may help, especially by yourself. But to really be, having something consistent like therapy. If you're someone who struggles with that, especially because it can be cyclical, if you are in therapy, that's the person that you can check in with, and they can give you feedback. Because honestly, and I think to Wanda's point, you may have parents as young people, or even spouses or friends as adults, where they just may be hovering, and it may feel like, why are you like all up in my space, and and you're doing that thing again. And so, but a therapist is an impartial person, and if you have a relationship with them, they're gonna know you. So you can kind of check in with them, and then the other people around you, it may not bother you as much when you hear those comments of like, are you okay? Or what's happening? I noticed something different, because you have that other person to check in with. So I recommend, for Christians, do your prayer, do your Bible study, and do some therapy as well. Advocating for both of those things, they can coexist and be very beneficial. So I'm sure other people want to chime in, but I would say that is one thing. Therapy doesn't work for everybody. Not everybody's ready to do that. Some people find it really beneficial to exercise and get a lot of benefit from exercising, using their body, getting those endorphins going. That works for a lot of people. And if you can be consistent with that and that works for you, keep it going. And so it really depends on what works for you. But those are a couple of things I would say.
Okay, all right, thank you. And to Wanda's point, I think we've all experienced, as as even teens, we were once teens. This wasn't too long ago. So, I remember breaking up with my first little girlfriend, and I didn't want to eat. I was depressed. I was heartbroken. Yeah. And I didn't know, right? No chicken, no nothing. I didn't want. Yeah. I didn't want no Annihilators. I didn't want no Jolly Ranchers.
No chicken?
I didn't want no penny candy. I didn't want no Chico sticks. I didn't want nothing. No Chico sticks. I know some of y'all know about that Chico stick, but yeah. And so those things happen. And so identifying that as okay then, but that's knowing your child again. You have to know. If you don't know they have a friend, whether you want to call them boyfriend, girlfriend, whatever the case is, then that's a challenge too. As a parent, you should know of your children's relationship. You ought to know. If your daughter like a certain person, hopefully your wife will tell you. Whoever that person may be. So I depend on my wife to tell me certain things so I can be aware. And sometimes she depends on me to tell her certain things so she can be aware. But anyway, let's get back on that. That wasn't in the questions here. I just kind of trying to help people along your Christian journey. It's gonna be okay.
That came out your spirit.
Right. My daughter's a teenager, so I'm preparing myself. But I got people around me has kind of been this route, so I'm leaning on them, you know, to kind of help me get through this thing.
Amen.
And so, okay, Dr. Greg, when do you typically suggest medication treatment for depression? Because I know that's something people don't like, you know, they think the whole about therapists, especially in the African American culture, people black and brown, that we don't do, you know, oh, therapy, I mean medication. You ain't put me on nobody's medication. I don't need no medication. And so I ain't going to therapy because they're going to put me on medication or try to put me on something. You know, they watch stuff on TV, you know. They're going to put me on some of them uppers and downs. And you think, and I'm not even joking, people actually think this way. I've had conversations, you know, and all these therapists, doctors, and people, social emotional people, they know. People are talking this way, you know. It is almost anti-culture to go ahead and get the help that you need for your fear of being, you know, characterized as somebody who's depending on medication, you know, like this, you're less of a man, you know, but or less of a person, you know. So what is that? What is your typical suggestion for putting people on medication treatment for depression?
It's funny that you asked that because last week I had a patient who I have a really good relationship with. He was really activated. He was agitated when he came in. He said, I almost didn't come to this appointment. I was like, why? He's like, well, because I figured you were going to tell me that I need to be on medication. And he had recently had an outing where he went to, for those of you who don't know, I work at the VA, the Veterans Administration. And so he said that he went to the AMVETS and he saw one of his friends, and his friend was almost like a zombie. And when he had asked the man's daughter, who was also there at the AMVETS, he was like, yeah, he took his medication, and he was like, is this what it's gonna be, what it would be like for me to be on medication? And he had these stereotypes that came up, and he was like, when he came to see me, he said, I almost didn't come today because I was going to ask you, you know, I have PTSD, and, you know, I figured you were going to tell me I had PTSD, so I had to be on medication, and my friend was like a zombie, and I'm like, I'm not trying to do that because I don't trust the government. I mean, I trust you, but if you were going to tell me, so there are these preconceived notions about medication. And, you know, I am the type, I'm probably typical to a lot of therapists. Like, I want to assess the issue first. You know, I want to assess the severity of your symptoms before I make a recommendation about medication. You know, I want to start at the lowest level of treatment, which is just talking to you about it and helping you to develop some skills. And so I tell people right off the bat, I'm an advisor to you. You know, I have input, but you have say-so as the patient. So I kind of put that right in their hands, that power right in their hands at the very beginning. So they know they get to make a decision. But how I start the conversation is, you know, sometimes talking about your problems isn't enough. Sometimes it has some relief, but doesn't provide you with a lot of relief. And so, you know, I kind of liken it to, the medication conversation to, you know, injuring yourself. Like if you sprain your hand, right? Or if you hurt your hand, sometimes it's just a sprain, and sometimes you just gotta walk it off. Sometimes you sprain it really bad and you need like a brace. You know, sometimes you break your wrist and you need a cast. Sometimes, you know, you break your wrist and you need like, you know, a cast for a long time, or you need surgery. Sometimes you need pins in your wrist, and sometimes those pins are permanent, right? And so I liken that to the whole attitude about medication. Sometimes just talking about your stuff can relieve your depression. Sometimes, you know, if you take some medication for a period of time to get you over a hump until we can start teaching you some skills in therapy, then after you start implementing those skills, then you can reduce the medication or you can get off the medication. Sometimes, though, for people who have long-standing depression, right, or some deep depression, sometimes they need to be on medication for a long period of time. And sometimes that can be several months, sometimes that can be several years, sometimes it can be life, just like those pens. You know, I was mentioning in terms of the wrist. And so we have, you know, for me, when I have that conversation, again, I say, I use that kind of, that idea of how long do you need, how long do you think you need, where do you think we are right now in terms of medication? And, you know, so that's kind of like the formula that I use to think about that. Again, making sure that in terms of the veterans that I serve, that they understand that they have the power to make a decision about their medication.
Mm-hmm.
And also, if they decide not to make medications, what are the pros and the cons of that? Because if they really need medication, but then they decide that they don't want to because they're concerned about the after effects or whatever side effects or the stigma, all right, so what are some compensations or what are some degradations in your quality of life or your performance that you're willing to deal with in that regard? So we just have an open and honest, come to Jesus, as my daddy used to say, conversation about that.
Okay. That's good. That's good. So, Wanda, you got something to say?
I just wanted to add, as somebody who personally experienced being on medication for a temporary depression, that somebody who works in this field, who knows all of the tools and coping skills that I thought I knew to use, still did not get me where I was trying to go. And I had to come to terms with the fact that, you know what, I need to seek out professional help. Everything that I knew wasn't working. And guess why? Because it really is a chemical imbalance in our brain.
That's right.
Am I saying the truth? Yes.
100%.
And you can't control that. There's nothing, there may be nothing you can do physically to change and get that balance back. And that's what medication does for people that need that. And so it's temporary, you know, and you have to take the medication as prescribed. You have to check in, you know, and give it time to work. And check in with your doctor regularly to say, how am I feeling? Is this one working or not? Because there's a variety of medications. And there may be one that works for you and the others don't. So you've got to give it time, and you've got to be willing to try different types of medication to find what works best for you. And so I would encourage anybody to seek that out and to gain the knowledge that they need and go to a doctor to find out what it looks like for them, what are the options, so that if it does come to that, that they are open-minded enough to say, you know what, I'm going to keep it real with myself. You know, I can't do this by myself. And talking about it, seeking therapy, exercising, you know, getting some sunshine, you know, all of those things may not be really helping me get over that hump as you described, and you might just need that additional support, and it's okay.
Yeah.
Oh, boy. Thank you. Thank you. A little clap go right there. I'm clapping by myself, but no, it's just, go ahead, Greg.
Oh, I was going to say to that, I think there's a lot of stigma towards the medical field because, I mean, you can see all of the different medications on TV and stuff like that. I mean, it's like every day they add about 12 or 15 different commercials for new medications. And so I probably shouldn't say this, but I'm going to say it anyway because it's my truth. There are a handful of psychiatry colleagues that I trust at my job that I'm like, look, this is somebody that I work with and somebody that I trust. And this is somebody that's going to tell you the ins and outs, the P's and the Q's of the medication. This is somebody I would send my loved ones to. I would like for you to talk to, I suggest that you talk to this person because they're going to keep it real with you. Because I keep it real with my patients, and they're going to keep it real with you about the medications because of the side effects, because of the stigma behind it. So that's what I do. And I also tell them that I'm on medication myself, and I'm not going to ask them to do something I'm not willing to do myself.
And I think, I know we got a question out there, but I think I don't want us to breeze past what Wanda said and what Greg just finished saying, is that the people who know the tools, who use the tools for other people, who this is their profession, this is what they do, this is what they do. If they're getting the help, my friends, my brothers, my sisters, and these are all believers. And no matter how hard my wife prayed for her BFF, Wanda, that was not helping her get over that. And so sometimes we camouflage our stuff and over-spiritualize it, that Jesus is going to get me through. Yeah, and I'm a preacher, and I understand, I got all that. But sometimes Jesus is not enough. That Jesus needs us to go and use the wisdom he has given us and go get some help. So we can be the best person for Jesus in the kingdom and who Jesus is calling us to be and working our own purpose and our passion. Because if Wanda and Greg don't go get the help, hurt people hurt people. Pretty soon their wounds will start infecting others. And then they can't actively or real efficiently help the people they need to be helping, which takes them away from the purpose that God has called them to do. Now I'm going to stop right there because I thought I don't want to sneak a preacher there. So
I do want to add a little bit.
Go ahead. We got a question, but I'm going to go get the question. You go ahead.
I was going to actually talk about what he's saying. I'll speak as a pastor myself for this particular topic. I think sometimes, I know for sure that theologically some people have, I would say, have received correct information. We're feeling like God cannot use medication as a form of treatment. And I think that I like to actually speak to that directly, because I think that God has provided us with a lot of different, methods to kind of help. I see medication as one of those tools to be used. So if I have a Christian who have received, who I think, incorrect teachings of, okay, it is no way, God told me that he's going to heal me. I don't need therapy. I don't need medication. I just need to continue to pray. I would say seek additional Christian advice. You heard one perspective from that person, get two more perspectives from other people, and then come up with your own way of looking at it, because theologically, I do think it's a barrier for some people. So I'm glad that you heard our senior pastor talk about that.
Right. Question?
How do you explain and encourage people to try more than one medication? I feel like a lot of people try one medication and it doesn't work, so they're done. Even therapy, they may see one therapist, one counselor. They don't have that relationship from the beginning, and so they're done. So how do you encourage people, because it's not a one-size-fits-all. So how do you get them to continue seeking help?
I think for me, the way I kind of, and I'm going to say this a little bit and let these guys attack this question also. But for me, I try to explain to my patients that medication is not all a one-size-fits-all. You cannot talk to another person who has the same dosage, the same medication, and it's going to affect your body the same way. So I like to break down those barriers with that. The other thing that I would say that comes along with that as well is that, especially with kids and teens, because their bodies are still developing. I mean, as your body develops, the doses are going to change, coexisting, things would impact that. There's so many different scenarios that's going to impact that medication for that individual. So I think that just really reminding them that the one medication, you can't compare it to anybody else, and at the same time, you have to take it for a particular length of time to be able to let that person know how long it's going to impact them. And the last thing I would say is I always encourage my families to journal. Because when they talk to either the psychiatrist or their family doctor, what they tend to do is only remember the last 3 days of what happened. So I encourage them to journal so that way when they go and they ask how the medication is working, they're able to remember that last 30 to 60 days or whatever the case might be, to be able to give them a little bit more information.
That's
good.
good. Yeah, I like that. I think there are a couple of other things. That's a really tough thing to do, first of all. But I think as a psychologist, I don't prescribe medication, but if I'm going to talk to a client about that, then I am going to encourage them to talk with their prescriber, their doctor, about their symptoms. So don't go in and say, I think I'm depressed or I think I have anxiety, but to really kind of hone in on their specific symptoms. I'm not sleeping very well, I'm irritable, I can't seem to get things done. Because then as the prescriber is for someone who's listening as a prescriber, then they're gonna have the knowledge to get maybe a specific medication meeting their symptoms and not just the one they like to prescribe first for people. So I encourage, people, talk to your provider about your specific symptoms. Don't go in and name what it is, but what your symptoms are. And then I, talk with them and ask and encourage them to talk with their prescriber about potential side effects. Because if they know kind of out the gate, like, okay, I may have some GI upset, or I may have to, and some of this I may need to push through, then they may be more likely to say, okay, I at least know what this is, as opposed to, well, I didn't realize I was going to have that. I don't like that. I don't like how that feels. But when you're talking to a prescriber and they're saying, okay, this is going to happen, this is what you can expect. It should last X amount of days or X amount of weeks. You should start to feel something different then it's almost like they can kind of wait it out if it's tolerable for them. But for people who they're just like, they go in and say, I'm depressed, they may get whatever antidepressant. The prescriber, likes, or it feels like it's usually a good fit for most people. It may not get at their specific symptoms, and then if they don't have a good sense about the side effects, it's really like a wash with people. And so doing that kind of on the front end, I talk with them about what some of the, specific things that kind of coaching them of how to have the conversation with their prescriber, and that seems to help. With the therapy, I think it's a similar sort of thing. For people that like I develop like lists. I'm sorry, am I doing something?
Oh, just move your mic down a little bit, your hair as you.
Oh.
Yeah, that's it. Kept
Okay,
you hearing
okay.
that little. So.
My bad, excuse me.
No, it's all good. Just need to move it down a little bit. You good? Are you?
Okay. Move what down? The mic?
That's the mic.
Oh.
Oh yeah. Because I know Greg don't want you cutting your hair. So
Oh my goodness. Anyway, y'all done got all off topic. So anyway, what I was saying is with the therapy, it can be a similar sort of thing. But if you have a list of people that like you trust or you refer to regularly, it's like Greg was saying, if I can say, I trust this person, I've worked with you, I think you can work with this person, I think they'd be a good fit, then it's almost like you're helping with the bridge. Like, so if you could do that warm handoff of this is somebody I know or somebody I trust, then that I think can help with that process. And then just continuing to encourage people, if it doesn't work, give it a few sessions. If you feel like, I can't talk to them, then let's look at what specifically do you need. And let's see if we can get you directly to someone who can help with that. So as a provider, I like to have options, because if I'm going to do a handoff, I'm not going to just send somebody to, go to this organization. As best I can, if I can do a warm handoff to somebody specific, that helps. So,
Thank you for that great question, and there's been some really great responses. But as everybody was speaking, I was thinking of some analogies. If you have an ailment, you don't feel well, and you go to the pharmacy, is there only one medication for that particular symptom that you're having? No. There's a whole lot, a whole row of them, right? And so you got to find which ones meet your symptoms, which ones work for you, and this is no different. I have different medications for all the aches and pains that I have, and there's different ones I take if I have a headache or if my back hurts or whatever it may be. And so to me, it's no different. Most people will seek out and try different types of medication for other issues that they have, and this is really no different.
Words right out of my mouth. Brother Greg.
I was going to say two things. First of all, when we're talking about medication, I like to mention interaction effects.
I don't know what they
Because sometimes, I'm just gonna keep it 100. Sometimes we're using substances like alcohol or tweeds,
Tweeds was
weed,
weed.
marijuana,
Oh, okay.
to manage, to self-medicate, and in an effort to make ourselves feel better, which is contributing to our depression. And then if you want to add medication to that, it kind of throws things off. The medication doesn't work as well. And so when you go speak to your provider's going to ask you what all kinds of substances are you choosing to use. And so we need to be honest about what we're using with our providers so that they can get a clear picture of what we might be using. Because if you digging yourself a hole, if your hole is depression, and then you're adding marijuana or cannabis or other substances to that, you're just digging the hole deeper, but then you're asking somebody to help you out of a hole that you're choosing to dig.
And they don't understand.
And they don't understand. They
All
don't
of
have the
what's there.
full understanding of what's contributing to the depression. So I would throw that out there. And I like the idea of, using medications. The idea that you go and you pick a medication, to handle different things. The other thing that I tell my patients is that, if you're meeting with me, and there's something about our work together that isn't working for you, either let me know or fire me and find somebody else. I'm very blunt about that. Because I don't want somebody to say, well, just like Anthony was saying earlier, I tried one medication and it didn't work, so I'm not ever trying the medication again. I also don't want somebody to say, I tried one therapist and therapy didn't work, so I'm just gonna give up on it. Because a lot of people drop out of therapy because they have a negative experience that influences them to not try again. So I'm very clear with my patients. I don't want to be the reason why you didn't get the treatment that you deserve. So fire me and let me help you find somebody else. I'll help you. I don't have my skin is not thick around that.
Okay.
I'm probably not, I have 3 other experienced therapists here. I know y'all probably wouldn't say that, but I'm a little bit off the cuff.
I'm in private practice, so I don't tend to say a lot.
Okay. I work for the government.
Dr. Anthony not trying to affect his bottom line. He's like, hey.
I do have one quick thing
Go ahead,
just to
Susan.
add about going back to side effects too, and this is for the married folks. But if you do start a medication, and I think if you're a prescriber and you talk with people, the sexual side effects, we need to talk about that. Because if that catches somebody off guard, it's not going to be a good look on the back end. Because it can be a reason why somebody won't want to take the medication if it does have a sexual side effect. So if we can put that on the front end, and we're talking about that and making sure that that's a conversation that's being had, that's a really important one. And folks don't like not knowing that. And then because the other part is they can be feeling better and have more energy and may want to engage.
Amen.
And then there may be some challenges with that based on the side effects of some types of medication. So just highlighting the importance of discussing the side effects so that people are clear. And we can also talk with them about creative ways and things that they can do if there are issues, because that still doesn't need to be a reason why you don't take it. But just having that information and having ways that you can address any issues that may come up.
That's good.
just
Amen. Don't keep it a secret.
No, we don't want to keep
Tell
that one a
somebody.
secret.
Do not suffer in silence.
Don't suffer in silence. Lord Jesus, help us in there.
Right.
That's all I'm going to say about that.
Okay, amen.
Somebody sent me a message, told me to hush. And so I was getting too excited. I was like, wait a minute now. And so, yeah, but that's good. A good conversation, good suggestions as it relates to how people, look at medications and those type of things, And I'm gonna say one thing, I'm gonna keep moving, is that about finding a different doctor. My daughter, we recently had a conversation. She asked me the other day, what happened to, the side of your head? I got a part on the side of my head where no hair grows. And it's not DNA, it's not my mother's fault and her family that I'm bald, They part of the reason, but it's not, this part is not, And so I was going to a doctor, a dermatologist, who didn't understand what he was treating because I was an African-American male, and I don't think he kind of knew. He was a white doctor. He was a dermatologist, had his license, but he didn't really know how to treat what I had. So I had to find somebody. My father and my mother said, okay, we got to stop going to that person because what he's doing is not working. And that's okay, So we left that dermatologist and went to another dermatologist who was able to treat the symptoms, and so I didn't lose all of my hair while I was in high school. So there's nothing wrong with finding different people. That's what I'm trying to say. If that therapist, Greg, he too rough and tough, and you don't like his alpha male personality, then go see Dr. Anthony, because he's a private practice. He's taking everybody. Y'all come on in here. Whatever you want me to say, I'm gonna say it. It's gonna be okay. Because he don't want to go. He ain't gonna try and go home and have his missus looking at him like, hey, brother, you gotta go get that money now. You take everybody. And so no, I'm just so how we do here at Life Transformation. Laughter happens right here. We gonna laugh and have a good time, even though we're dealing with this March Madness. And so our next question is Sister Wanda said, my child is threatening to hurt him or herself. What should I do?
I'm so appreciative of you guys asking this question today, because we see too often that our parents don't share with the schools what their children are dealing with. And first of all, I'd like to say, no matter what the circumstances are, take that serious. I've seen cases where a student has said many times that they wanted to hurt themselves, and then it becomes like, what's the analogy where it's like, the
Boy cry wolf.
Yeah, exactly, right? And so you're like, they don't really mean it. And unfortunately, we had a student who ultimately did commit suicide, and she had been talking about it for years, and people just stopped kind of listening. And so when we teach our kids about suicide prevention, and we talk with them about their friends, like anytime that their friend is expressing suicide ideation or wanting to cut themselves or anything like that, that we take that very seriously no matter what, and we will deal with it right there on the spot. That is a crisis to us. And so as a school, we take those things very seriously. But as a parent, of course, there's resources you can get outside of the school, but the school does have a lot of resources as well. And so please reach out. The 3 people within the school setting that we consider kind of our professionals when it comes to this would be your school nurse. Every school has one. They may not be full-time, but every school has one. Your school counselor, and some schools also have a school social worker. Those 3 folks are the professionals that can help your child develop a safety plan, and those would be conversations that you want to be engaged in, and you want to be a part of those conversations so that that safety plan can help them at school, but also possibly at home. And so I just always encourage our parents to not feel embarrassed or reluctant to call the school and ask specifically for one of those 3 people, and they will immediately drop what they're doing and help deal with that situation. A lot of our schools have other agencies that work in them to deal with mental health, whether it's children's or it's some of our other behavioral health agencies around the area that they can refer your child to. Unfortunately, we have a lot of families that get a little apprehensive when it comes to dealing with social workers or therapists through the school, and they don't follow through. And the school's no longer able to serve that student in that capacity, and it becomes a big challenge for us as the professionals on how to handle those situations, because we need parent authorization. And without that, we can't move forward with a lot of the supports that exist in the school. However, the school counselor does not need your permission. Let me be very clear. So if you try to call the school and say, I don't want my child speaking to the school counselor, if the child wants to speak to the school counselor, they have every right to. They do not need your permission to do so. But when it comes to talking with a therapist that may be existing inside of the school, we do need your authorization for that. And you have to be willing to share and be very honest with us about what your child is dealing with.
Yeah,
go
I'm
ahead.
sorry, I don't hate to stop you on, but something you said kind of disturbed me. A parent who is dealing with a child who's talking about hurting himself does not want to involve the school or let the school know. Why would a parent not want? Why? I'm a parent. I'm struggling to see why would you not want the school to know where your child spends most of their time and to know what's going on with them.
Good question. It goes back to the stigma. Parents feel like maybe they've done something wrong and they don't want the school to look at them in that way.
Parents are doing something wrong.
Or they are, and they don't want us in their business. But what I have seen is we've actually had students that we later find this information out, but they tried to harm themselves outside of the school. The parent took them to the hospital possibly, and the children's wrote them a safety plan, and then they don't turn around and share that with the school. And then we have to find out down the road that this child has not only tried to commit suicide, but there is a safety plan, and we know nothing about it. Those are very upsetting moments for us, because if something were to happen in that school, we are responsible. And if we don't know what's going on, we don't know how to address the issue. So I wish that I could answer that question a little better, but I'm only going off of what I think might be the reason. And so that would be some of the biggest barriers that we have, is when we don't get parents who want to engage with the schools and share information with us. And it just really prevents us from doing and providing the supports that we have available in our schools.
Wow.
Can I piggyback on that as well?
Go ahead. Yeah.
I think part of it as well is that it's, from my experience in working with schools, if parents don't trust you with little things, they're not going to trust you with a big thing. And I think that a part of what I think as professionals that we have to do better, and I know that parents, and I work at a lot of charter schools, so I know that we have a lot of people that just struggle in many different areas. But if our parents don't trust you with little things, they're not going to trust you with a big thing at all. I think sometimes we have a lot of people in schools without any life experiences. So when parents drop and say, hey, I'm homeless, or this happened, my boyfriend came out of jail and almost beat this kid, whatever, it's like they just don't want to share those type of things. So for me, I have the kind of personality where I'm like, hey, let's set Dr. Richard aside. You can talk to me. Let's just talk. And I think, when you approach parents like that, some of them will open up, because we're really trying to help them. We're really trying to help them. But the thing I want to say with this too, we're mandated reporters. So even as pastors, we're mandated reporters. So if we have a situation that happens, it's not a question or not whether we're going to call. We're going to call because we're mandated reporters.
Right.
So I tell people that my saying is that I would rather be angry with me and alive, than to pass away and we're cool. So if something happens, I'm absolutely going to call. I was struggling whether or not I should share this story, but I'm going to share it because I feel like it's worth sharing. I was with a different religious organization, I would say, just to put it like that. And we had a situation where I would partner with the prayer ministry, and we would decide what is a prayer issue and what's the issue of mental health. So we had a person that was suicidal, and a lot of the team at the time thought that that person just needed prayer. And I went into my mode of, what type of insurance do you have, and went through all of those things, because what some people don't realize that even if you go and get help and you have to stay, they're going to give you a bill. They're going to give you a good sized bill. So I was trying to help prepare them for all of those types of things so they're not surprised by all of that kind of stuff. Well, they went out and prayed for that person. I think we left for Pennsylvania soon after that. And like a month later, that person committed suicide. That person died. And I think that the moral of the story with this is that as professionals, you have to trust us. when we say go to the hospital, I would recommend you go to the hospital. Let the emergency room sort that piece out. Let them sort that piece out. But I think too many parents do try to hide it, and kids are being hurt. I mean, they're really hurting themselves because there's a lot of videos to show them how to kill themselves.
Yeah,
Only thing they need is a phone to show them how to commit, how to do it.
yeah. A very close friend of mine I grew up with, his son died by suicide. He was a college student, and so that subject, which we will be coming to Life Transformation, our next mental health discussion will be about suicide in June. And so, but I had a friend whose son passed away by suicide, and so, and you know, I asked him, I said, man, was he getting help? He said, yeah, he was getting help. You know, we knew about it, you know. And so, and I think to Anthony's point is that we have to know, I think even as believers, what is our boundaries, you know. Where there's power in prayer. The Bible said the prayers of the righteous, what availeth much. I got all that. I'm good with it. I've been to seminary, I got all that kind of, yeah, I know it. But as believers, we need to understand what our boundaries are so we give people the proper help and don't just think you're going to pray something away. So it may not be, maybe more than that, you know. And someone's talking about hurting themselves, and so we need to make sure we are addressing these things in the proper way. And as Pastor Anthony said, as clergy, we are mandated reporters, you know. So, and I've dealt with that. You know, I don't care about you being mad at me. I really don't. Yeah, I'm not going to lose any sleep about you being upset with me, you know. If that means you living, living is going to be at the forefront of my agenda. Yeah.
Amen.
I want to add the other side of that. So if a student comes to us and says that they are thinking of or have attempted to hurt themselves, we will call you as a parent. Now it is then your responsibility to get that help outside of the school. And a lot of times we have parents who don't follow through on that, unfortunately. And so it becomes this back and forth with us, but we can still support your child. But just know that if your child comes to us, and maybe they haven't come to you about it, but they share with us that they are thinking of that, or we see that they have cuts on their arm, we are required to call you as a parent and inform you. Our next step is going to suggest, we can't tell you you have to, but we will suggest to you to seek other therapeutic supports, or potentially even immediately have you taken to the hospital, depending on the severity of it. And unfortunately, we've just had some situations where the families won't come and pick their child up. And we, have to end up calling the authorities to escort that child to the hospital because the parents refuse to come for whatever reason. Again, I think when it gets into dealing with mental health, there's the stigma, but then also there may be some things going on in the home that they don't want us to know about, they don't want the authorities to know about, and they're afraid that their child may share that information with the doctors or whomever, and so they avoid. And it's just a constant kind of back and forth, but we have to educate our parents as well as our children about the importance of addressing our mental health needs, why events like this are very important.
I was gonna,
No, I'm gonna go ahead. I'm gonna get you, sis. I'm trying to stay saved on this discussion, but ladies and gentlemen, brothers and sisters, as a parent, get your life together. She's not making this up. She works in the school system. How can we not take care of our children? God gave them to us as a blessing. Do your part. If you need help, get the help that you need. If you are a single mom and you struggling, or a single or whatever situation, and you're in a domestic violence situation, get out of that. It is literally killing your children. Drug abuse, killing your children. Any unhealthy relationship, get out of it. Get the help you need so you can be a help to your children. This is breaking my heart to hear that parents won't give their children the proper help. that they will call and reach out to the parent, and the parent won't even respond to pick the child up. And as people of faith, we have to recognize this and realize these situations, these discussions must continue to happen. Because there might be some of us. And that's all I'll say about that. Go ahead, Sister Rena.
I was actually going to speak to exactly what you just said. It just really strikes me again that just thinking about the perspectives of shame, I really think we just cannot underestimate how impactful that is. And then also some parents are in denial. And that's a real thing of, is it that bad? And I think even not even dealing with depression, anxiety, or mental health, there may be parents, myself included, who've had something happen with the kids and thought, oh, I didn't think it was that bad. Oh, I didn't know, even with the sports injury. Oh, okay, I thought you was okay. I didn't think it was that bad. And so I think there can be this either, obvious denial or just ways that people can rationalize that something's not that bad. And so that can be one of those things that really can get in the way of parents trying to help. I appreciate that you mentioned domestic violence. We are not talking about that a lot or as often as we need to. And really the complexities of that. And can I be safe as an adult who's in a domestic violence situation? And if I can't keep myself safe, how am I feeling about not keeping my children safe? And am I going to be okay sharing that with somebody else? That I'm in trouble, I'm not safe, and then I can't keep my children safe. For any parent who is not on substances, and I would say even those who are, if you don't think you can keep your children safe, that gets at you somehow, even if you self-medicating to not deal with that part. And so I think it really is so important, that we talk about, why would parents not? What is really happening there, and then how can we have interventions for parents so that they can get the help and the support that everybody has spoken to, so that they can feel confident enough, safe enough to be in communication with people at schools, with authorities who they may feel threatened by and feel like they can't trust. And so it really is such a complex situation, and so I'm glad we're having the conversations and thinking about it, because for some parents, I'm sure it is a quandary. My heart was breaking as you said that, and so I'm trying to think, what would happen? Why wouldn't a parent do that? And I think there are some reasons why parents wouldn't do that, and we really have to kind of understand that and meet the needs of parents' mental health so that they can meet the needs of the children's mental health.
We got a couple questions in our little small audience here.
So I said, as a high schooler, how do I deal with the situations of knowing the difference between students actually wanting to commit suicide and them playing with the term? And then if they're playing with it, how do I confront them to take it seriously, or is it even my job to confront them?
Read the first one again.
As a high schooler, how do I deal with the situations of knowing the difference between students actually wanting to commit suicide and them just playing with the term?
Okay. For me, I treat it all serious because you have this piece that's called, with the cutting part of it, I think that sometimes people will cut, but they will cut because of a disorder that we call borderline personality disorder, which is not necessarily in kids, but we see it, we can see it in kids as well. So sometimes if you went through some emotional trauma, we'll have people that may cut because it helps them feel. It helps them feel. So, but regardless of whether or not they're self-harming, because we put it on the self-harm, regardless of whether or not they're self-harming because they're emotionally kind of just, I don't know, yeah, they're numb, thank you. Because if that or it's an issue of depression, they still need help. It's still an indication of that they need help. You know, so I would always say take it serious. To parents, just to say, to add a little bit before these guys, when you look at self-harm, look at every place. If they're females, moms, have them go down to their underwear and their bras and look at their whole body. I've had kids in high school that have cut so bad on their arms that when I look at that, it gave me chills. When you have kids that it is 90 degrees outside and they're wearing a hoodie, it's something wrong with that. If they're always covered regardless of weather, it's something wrong. So some kids are cutting on their upper thighs. They're cutting in places where we as adults can't look, professionals, can't necessarily look. So I would have parents say, go in the bathroom and check them over. Because I can have them show me their arms, but I can't, do all the rest of that stuff. But kids cut everywhere. They cut everywhere. They're using lighters, dry ice. It's all type of things they're using to self-harm. So I would encourage you guys, even razors, they would use that to cut. So scissors, razors, knives, anything sharp they would use to cut. So if there's an issue with that, I would say get them help. Because that's an absolute deeper, it's a deeper concern with that.
To your first question, because I don't remember the second one, so we'll come back to that. But as a high schooler, as a friend, as a young person, it is not your responsibility to know the difference. It's your responsibility to go tell a trusted adult, and that's it. But first, before you do that, because a lot of our kids are worried about, like I think you mentioned earlier, that you're gonna, make somebody angry, and then, they're not gonna be your friend anymore. You rather them be around than for them to, decide that they don't want to be your friend anymore, right? You want them to be around regardless. And so you want to also tell your friend, hey, I know that you are talking about this subject. Just know that I'm going to tell somebody because I'm worried about you, or I can take you to talk with somebody. And that's part of the program that a lot of our schools have. It's called Signs of Suicide, and it's why it's so important for our kids to hear these messages so that they have the tools and the understanding of what they need to do if they have a friend who is expressing wanting to harm themselves, whether you think they mean it or not. We have to take it serious every single time. And the role of a student, of a friend, is to simply go to that friend and say, what's going on? I noticed that you are feeling, this type of way. Can I walk you to the counselor's office right now? Or if you don't want to do that, just know that I'm going to go tell somebody because I'm worried about you and I care about you and I love you and I don't want to see anything happen to you. And that's your only responsibility.
Sorry, I was going to use my Army command voice, but I realized that might not translate very well to the interwebs. It's a huge burden to keep a quote-unquote secret. If somebody asks you, hey, I'm thinking about killing myself, that's not a burden that anybody should carry. There's a limit to how much of a secret we should keep, and if the secret involves somebody's life, that's not a secret that you should keep. Because if they tell you that they're thinking about that, and then they go through with that, that is a lifetime burden to carry. So that's when you should go get help. There are certain, Jamie, not you, Jamie, I'm not saying this, but Jamie likes Christy, right? That's a secret you can keep. But Jamie broke up with Christy, and now Christy's thinking about going to kill herself, and that. That's not a secret to keep.
That's good. All right, we got one here, and we'll get back.
I want to make sure that we get to her second question as well. I don't know if we addressed that yet or not.
You kind of answered it, but I said if they're playing with it, how do I confront them and take it seriously and use my job?
Yes, just to repeat that, if somebody, whether they're playing or not, take it serious, confront them in a caring way, and let them know that if they don't go to somebody to seek out help, that you will go to an adult for them on their behalf.
I just wanted to know if there were, because I'm sure that there's people out there that don't report it due to lack of financial resources. So for whether it's a parent, reporting that for their child, or whether that's an adult that's not maybe reporting it for themselves, are there resources for people who don't have the financial, maybe they don't have insurance? Where could they go?
I think most hospitals have some, what do they call it, charity care, and qualifying people, especially if you don't have the resources, most of them do. And I know with local hospital systems, I think Ohio Health has it, you can write a letter even. Now, it may be an extra step for you to do, but you can even petition on behalf of being able to use whatever your situation or your story is, and to write that and kind of to petition for that, those resources. So most systems do have some level of charity care that they provide. And and for people who are on Medicaid, they cover pretty much everything.
You
So
can
that's a
also
good
call
question.
NetCare. NetCare is with adults and primarily Children's Hospital. They're going to send you over for kids, but NetCare is on Central Island. It's off of West Broad and Central. It sits back a little bit, but just look up NetCare, and they have a crisis line. And what NetCare does is connect you to services for the city kind of services, So if they don't have insurance and it's an emergency, they'll actually come to you as well. So if you just call and say, hey, it's an emergency, they'll help link you to those services. I've used NetCare many different times, so I would encourage that for sure.
Thank you for mentioning the hotlines. I forgot to mention this earlier. As a parent or as a friend of a student, there are hotlines, national, local, state level hotlines that you can call anonymously and ask for support, or have your friend that is saying those things to reach out to those hotlines as well. That's 24/7. Those are available, and I think we could provide maybe in some sort of way a list of numbers for
Website.
those who are interested in that.
As a pastor, too, I want to say, as a part of Life Transformation, you can call me any time of the day. If whatever time it is, if you're like, I want to hurt myself and I need to talk, I just think that's a part of the calling. So I would say call one of us at any time. If, me and Dee get together and kind of help, or I'll be by myself, it does not matter. I would say if you can't, Lex, if your friend can't talk, or whoever can't talk to somebody, have them talk to one of us. Give me a call. This is not a profession for me. This is a calling. So I think whatever needs to happen, I'll help you make that happen.
Mm-hmm. All right, we had another question. Yes, sir.
So, recently I had a friend, I'm not going to say her name, but she was talking really weird over text and everything, and usually she talks weird, so nobody ever thought about it, but a few days ago she tried to drug overdose, and the day we came back to school, that impacted almost all of the 8th grade, the whole 8th grade class that we had, and everybody didn't understand what was going on, because not only did she mask it so well, she just the word choice that she was using when she was saying all these things, and the timing that she was saying these things, kind of made the whole 8th grade class think that she was just playing around, and it affected just the whole 8th grade class. But how are we supposed to function if that happens and nobody else is going to know what to do?
Thank you for sharing that, and I'm sorry that you are experiencing that, and that that's the other thing, is that it really impacts so many other people besides the person or the immediate friends. And if you are feeling like, this is something we need to discuss as a whole grade level, like we need to have a big meeting with the counselors and the support people to help us understand how to deal with it, because you may then, or you may have some other friends that are like, wow, now they're feeling some type of way, and it just kind of goes into a continuous issue, and nobody feels like they have, or they are empowered on how to help. So I would encourage you or any of your group of friends to approach the support people in your school and let them know that, hey, as a collective grade level, we are really still struggling with this. We need your support. And that could look like many different things, right? But maybe there's individual students who will come forward to get that extra support. But please always advocate with the adults that you trust in the building. Maybe it's a teacher or an administrator as well. But you got to let them know that, hey, this is something that we're still struggling with. There's conversations that are happening, and we didn't, know how to deal with it. We want to be better prepared and equipped to help our classmates, and so we need your help. And there are many ways that they can go about that, and hopefully they will address that. If they don't, let me know, and I'll call that principal, okay? but trust and believe that they are responsible to help you guys deal with that, and you all need that support, because it can be very devastating, even if a person survives from that everybody, like you said, may not taken it seriously, and they feel guilty or any of those sort of things. You guys got to process that. We don't want to sweep that under the rug, because that's real, and that can manifest and have ongoing issues. And so thank you for bringing that up, because that is something that your school needs to deal with, and hopefully you'll get the support that you need.
Yeah, those ripple effects, can last for a really long time. And you're not, like to Wanda's point, you're not the only person that is probably feeling that way. And to just kind of hold it in only perpetuates the stigma of people getting help or people reaching out.
It's on this side.
So that's the only thing, that's one of the other things I would say.
It's services. First of all, this is, I think I kind of hit this moment in my spirit where I just feel like I hate that you guys are dealing with stuff like this. My prayer for you, man, is that stay focused on Christ. That's my prayer for you for sure. But there's a service that's called CISD. This is Critical Incident Stress Debriefing. And a lot of people, service that. So I want to equip you to say, go to that teacher, go to that principal, say, I heard about a service that's called Critical Incident Stress Debriefing. And it's counselors that would come in, and they would debrief the whole entire school or class or whatever on this critical incident. And I would say, let them know what's out there if they don't know, or whatever the case may be. But that's one service that your school can provide. The other thing I want to say is for you personally and for your friends is that one of the things that I found that with depression and suicide, one of the key elements is hopelessness. So we know that if a person gets to the point where they're hopeless, then we know that an attempt of suicide is around the corner. So you always want to help provide people with hope, because hope is one of those things that kind of help alleviate that symptom of suicide or suicide ideation.
Okay, thank you. Thank you. My next question was, so you said far back, like, I don't know, you said that no case was like the same, and that people are going through like completely different things. So what if medication is not working and therapy is not working, and they tried it more than once and they just feel like that's not what I'm feeling? Is there another way that they can like help themselves? Because if they feel like they really need to get something out of their chest and they can't do that, then that's really going to impact like everything around them. So like what else could they do to help that?
I think getting the parent involved, getting adults involved really is key. That's a really good point that you make, because there are some people who they are trying. They have been diagnosed with depression, they are receiving therapy, they are taking medication, and they're still struggling. And I really appreciate you bringing that reality that just, for some people it doesn't just all get better, and especially right away. And so thinking about, what other types of supports need to be put in place. For some people, and there are even groups for young people, maybe it's also individual therapy, but also group therapy. And there are, organizations that have groups for kids and teens as well as for adults, and then sometimes putting in additional like support groups, meeting with people one-on-one who aren't therapists but like clergy. It's almost like you have to pull together as many resources as you can until you can get that person in a space where they are more stable. And sometimes it does take more resources, so that's a really good question. And it takes pulling together more than one thing. Whatever it takes, kind of as Dr. Anthony was saying, to be able to get people in a place where they're feeling better, it may take a little bit more than medication and even therapy. But instilling that hope and making sure that, even if you're doing medication and therapy and that doesn't feel like that's working, there's still hope. There's still other things that you can do, and sometimes the adults or the counselors and social workers in our schools, parents can help us to continue to problem solve that. But I think the big thing is, I would say for young people is, really trusting the adults. And I know sometimes it's like, well, if I tell an adult, they're going to do X, Y, and Z. But we manage, businesses, we manage our households, we manage a lot as adults, and I think just being able to trust that we can support and we can assist is helpful. And you can even tell us what your concerns are. I'm afraid that you're going to do X, Y, and Z, so that we can address even that with you, so that you feel comfortable and safe that I can do this, I can say this, and feel like this was still a good idea. So finding just one adult that you can trust can be helpful. So that would be the one thing I would say to the young people who may be listening is, find just one adult that you can trust. If you have one, that's a place where you can start, and that can be your go-to. So just trust one adult.
We can't, none of us, no parent, no child that I know of, I mean, there may be some around here, but no parent or child, or friend, brother, sister, clergy member is a mind reader. Mm-hmm. And so we can't help with things that we don't know about. So that's just something to think about.
Yeah. We got another question.
Actually, you just kind of answered it. A couple of months ago, there was a situation where a former Miss USA who on the outside looked as if her life was going really well, an attorney, well-spoken, former Miss USA, and jumped off of the 29th floor of her apartment building. Were there signs in a situation like this where everything looks like it's going great on the outside? How do you, I guess my question is, how do you prevent something like that from happening? She was talking to her mom, it sounds like several times a day, and everyone missed the signs.
I'll play off of you, my brother.
You know what I'm saying? I think what I just said is kind of, is kind of the factor, right? I think social media plays such a critical role in this. I'm not saying that social media is to blame, but people are very invested in social media in terms of impression management. I have to look my best. I have to be the best. I have to talk the best. I have to have the best. And they show all of that on social media. I mean, the lady was very accomplished. And I think internally, there's a lot of pressure to maintain that image, which increases the pressure, the internal distress and the pressure. And so, you know, people work very hard to either hide that or protect other people from knowing about their distress. And so sometimes when people are determined to both provide that image or to project that image of having it all together, and then they also don't share that with other people, it's like it increases this internal pressure, if you will, and it makes the pressure worse until one day or another that facade cracks and they feel that sense of hopelessness that we've all kind of touched on. It's too much. I got to give it up. This is the only thing I can do. So that's the one thing that I would say.
And I think, Wanda, you spoke, that was one of the first things that you said in talking about it. Some people who have made up their mind, they're going to do what they can to protect the people they love. And so they may try to hide kind of the obvious. They're going to keep posting, they're going to keep giving this presentation that everything is okay. And that's why for some people, it literally catches them off guard. It's like there wasn't anything that I could have seen. I talk to this person every day. Like, I know there was not something that I missed. And sometimes it is them protecting, they don't want that other person to either try to stop them, or either they don't want them to be hurt. So it can be really difficult for people, and I think that's one of the struggles with people who survive when someone has completed suicide, is that it's like, I missed something, and sometimes there wasn't anything for you to see, and that's likely very intentional.
One of the things that I've learned, and I'll just speak personally, when I first got licensed and was working within the field, one of the things that we can't do as psychologists is that we can't really share. So if I have a bad day, I can't go home and tell her what's really on my heart. Like, I can't share with anybody. And I also found at the same time, I was probably 5 to 7 years into pastoring, which also is a gig where I can't really share. So I found myself, really struggling to the point where I was breaking down. Like, I had all this stuff on me, I couldn't share with anybody. I couldn't really say what's going on the pastoral level. I can't share what's going on at work, but a lot of stuff was on me. So one of the things that I changed was, I figure if Jesus had his Peter, James, and John, I need my Peter, James, and John. I need a small group of people where I don't have to be Pastor Anthony, I don't have to be Dr. Rivers, I can just be me in every aspect of me. And I think for me, I've surrounded myself around folks, my inner circle, that allows me just to be me. I think too many times as professionals and as people, we are held to too high of an expectations where we have to always be on. And I think that if you feel people in your life that are like that, I would have them, I would encourage them to have accountability partners. Plus, I've learned I had to give people permission to speak into my life and to challenge me if they see me getting off bases like that. So I literally said, hey, could you have my permission to keep me in line, to have me step away, to do something to keep me healthy if you find me coming over here. Because if that happens, typically, like, we don't want to go to the pastor and say, well, Pastor David, you seen whatever, you need to do this, this, and this. We're like, man, I can't tell him that. That's not, we always say, stay in my lane. That's not my lane, right? So and that's still a struggle for me, I can't lie to you. But I've learned that we have to give people permission to speak into our lives to help us stay healthy. Because if we don't, people will not do it.
Mm-hmm. Yeah.
So we need those inner circles.
I think our time is wrapping up, and I want each panelist, we've kind of talked about depression, talked a little bit on anxiety. I want to hit this last one, fear, and if each of you guys will respond, then we're going to wrap this thing up. So what advice would you give to men, women, students and teens, or children and teens, about dealing with fear? What advice would you give them about dealing with fear? And we'll start with Brother Greg, and then we'll work our way this way, and then that'll be the close of our session.
In short, well, I work with veterans, so I'll be succinct with this question. So a lot of world events, political events, and things like that get my veterans activated. I mean, the past 2.5 years have been full of events that have activated the fear and anxiety in my veterans. And so one of the things I've encouraged people to do, and I've tried to do myself, is to focus on the things that you can control. You know, limit your exposure to things that activate you. You know, the news is quite activating for me. I'm also somebody that has been a lifelong person. I've been interested in the world, but a lot of the things, because of what Anthony kind of mentioned before, like, I can't talk to my wife about stuff that I hear, because a lot of it is bad. I can't talk to my colleagues. I can't talk to a lot of people. And so, you know, can't talk to my kids. I've got to be on all the time, or at least that's what I tell myself. And so there are certain times where I have to disconnect. And I disconnect from the news because that's very triggering, and I have to set boundaries around like that. So one thing that I encourage people to think about is, what are the things that are activating you? What are the things that are activating that anxiety or that fear? And is it possible for you to limit your exposure to those things, to set boundaries around both events, activities, and people that can trigger you? Because one thing I've learned, my wife has taught me a lot of things, both as a person but as a therapist. You have to have boundaries. You can't let everybody take your energy, and you can't let everybody add their negative energy to you. So setting boundaries, I think, is very important, and that starts with the things that you choose to take in.
I would say, I don't know that I would add much to that. I think it's really important to be aware of what makes you feel fearful, and to the extent that you can, try to limit that. And if it's something that you can't necessarily limit that you're, fearful of, is again seeking out support, whatever that looks like. For young people, again, the support people that are in your schools, and for adults, again, whoever you feel like you can trust it with, whether it's your pastor, your best friend, whomever, really trying to make those connections, because sometimes with anxiety and fear, it's about perspective, and so you're seeing things from one perspective, and sometimes you need a perspective shift, and it's hard to do that on your own, but another person can help you walk through that. So that's all.
Gosh, not much to add to that either. But to me, fear, worry, anxiety, those are all kind of similar issues that we might see in some of our youth. And first, you've got to be willing to share with others, whether that's your family or another trusted adult in the school, what it is that is worrying you or brings you fear. A lot of our kids deal with social anxiety. So not just anxiety, but social anxiety. So being in school can really trigger them. And so as young people, we have access, right, to anything and everything, but also it limits us because then we don't always think that we need to talk to an adult or another human being. We just go on YouTube or the internet and try to find the answers. And that's not enough. We have to reach out to those that care about us and share with them. And then say, okay, what can I do to deal with this? What are some coping skills that I need to learn that work for me? And you can learn those things in a variety of ways, but just being open and willing and being transparent about what your struggles are and seeking the support.
Generally, I believe that when we talk about like first depression is generally about the past, but fear and anxiety is generally about the future. So generally it's about things that actually haven't happened yet. So you've already anticipate that this is going to happen. So our oldest daughter had painted this thing for me with fear, and it says, fear, false evidence appearing real. False evidence appearing real. So one of the things I do to kind of help with fear for me is, or when I become anxious, is keep a journal. And it's more like a blessing journal of the things that God has really brought me over. So I can look back sometime and say, I remember when I couldn't do this, I couldn't pass this test, or, our kid was losing her mind, or whatever the case may be. And it really helps bless me. I have a hallelujah moment by myself, because I see God as really like, God, I know I'm facing this mountain here, but you brought me over 20 mountains. So for me, it's like I try to attack it like that. And I pray for any and everybody, whether you're saved or not, believe or not, I don't care. So for me, it's like, again, prayer is one of those things that I think that helps equips people to feel more supported.
All right. First and foremost, we want to thank these wonderful panelists that we have. You out there, where you're at coffee table, you're watching it on your living room, your family room, whatever. Come on, just thank them real quick for all that they have done and are doing, and the work that they continue to do. We thank God that you have to be called to this. Even though they are educated, this is a calling. And so we, again, thank God for you and your presence, and we pray that you will get whatever you need out of this session. And as a team, we are committed ourselves, Life Transformation Church, to doing this on a quarterly basis. Our next one will be talking about dealing with suicide, and we want you to bring your teens in. We'll contact the schools and all that kind of stuff. And so we just want people to come out, because everybody's dealing with this. The young lady that a question was asked of the Miss America, she was, in her, I think, 30s maybe, or 30s, something like that, But I heard older people are dealing with it. So everyone is dealing with something. And so we just, again, want to thank God for putting this in our hearts and in our spirits. And we just want to pray for you real quick, and then we're going to be done. Gracious and kind Father, we thank you for all that you are doing, God. We thank you that we believe in you. We know that there's nothing too hard for you, God, but we thank you that you've given us wisdom and discernment through your Spirit, God, that we believe in Jesus and we believe in medication. We believe in Jesus and we believe in therapy. God, and we thank you, Heavenly Father, for that brother, that sister who is out there, that man, that woman, that child who is dealing with some mental health situation or challenges, God. It's March and they're mad about March and whatever the situation is. We pray right now, God, in the name of Jesus, that you would touch them. God, that parent is lacking the parenting skills because they have their own situation going on. Get them the help that they need in the name of Jesus. God, we love you. We appreciate you. We don't want anybody to fall through the cracks. And as Pastor Anthony has said, it's your will. And the Bible said that all men be saved. So we're praying for you, my brother, my sister, my friend, whether we know you or not, that you get the help and the healing that you need. In Jesus' name, amen. Amen. We say Life Transformation, where love is spoken here, laughter is heard here, kindness is shown here. Life Transformation happens right here. Take care. Be blessed.